Hello, my name is Karime Gomez Sanchez, and this is my career opportunities presentation, and I will be focusing on a speech language pathologist. So first, what is it? Well, a speech language pathologist, or an SLP, works to prevent, assess, diagnose, and treat speech, language, social communication, cognitive communication, and swallowing disorders in children and adults. And this is according to the American Speech Language Hearing Association. So first, I want to go over some of the different types of disorders that they assist with. So first, we have speech disorder, which is a difficulty in producing speech sounds correctly or fluently. Next, we have language disorder, which is a trouble understanding others or sharing thoughts. Then we move on to social communication disorder, which is trouble with the use of verbal and nonverbal communication. Next, cognitive communication disorder, which are problems organizing thoughts, paying attention, remembering, etc. And last, swallowing disorders, which are feeding and swallowing difficulties. And again, this is according to the American Speech Language Hearing Association. So now I'm going to go into the educational requirements. So first, very basic, you require a bachelor's degree in communication sciences and disorders, or at least a related field. Afterwards, you must earn a master's degree in speech language pathology, which takes about 2 years, give or take. And this degree includes academic coursework and clinical practicum experiences. After you have completed your master's, you must pass the praxis examination in SLP. Afterwards, you must complete a clinical fellowship, and this is supervised and mentored clinical experience. Afterwards, you must obtain state licensure. The requirements for this will differ depending on the state that you are, but most of them follow the requirements that we just went over. And lastly, you must obtain an American Speech Language Hearing Association certification. And this outline was obtained from speech pathology graduate programs. Now that we've covered the education, I want to go into some potential work placements. This is definitely not an exhaustive list. There are other areas where an SLP might work, but these are the most common ones. So obviously you have school settings, and this can be a public, private, or charter school. We also have healthcare facilities. So these can be hospitals, nursing homes, rehabilitation centers, and or long-term care facilities. You might also start up your own private practice. That is definitely an option. You can also work in a university or college setting. You can either be a researcher or an instructor and even a clinical supervisor. And lastly, you do have the option for outpatient clinics. Now that I've gone over the educational requirements and some potential work placements, I want to actually bring in my professional and the interview that I had with them. So here we have Jacqueline Alvarado, MSCCSLP. She has a master's degree in speech language pathology, and the CCC following her name stands for a Certificate of Clinical Competence in Speech Language Pathology. She currently works at Chrysalis Aphasia and Adult Speech Rehabilitation right in El Paso, Texas. However, this isn't her only role. She also runs a nonprofit private practice. So now I will go into the interview questions that I posed and what she responded. So first, I asked what a typical day looks like. And she responded, quote, I typically see 6 to 8 clients in one day, and that's from 7 a.m. until about 5 p.m. every single weekday. Then every other day, I run my nonprofit through Zoom at about 7 in the evening. I also tried to follow up on doctor referrals in between all of that, but it can be challenging. And next, I asked what aspects of her career were the most challenging. She went on to say, quote, definitely dealing with insurance companies or not getting reimbursed for my work after I do the sessions. Keeping up with documentation for insurance companies is also very time consuming. So kind of a repetitive thing that was coming up was definitely not related to her clients, but just dealing with the insurance and all of the paperwork that she's expected to do. I then moved on to ask how she supports the development, either physical, cognitive, or social emotional, of the individuals that she works with. She went on to tell me that I believe in a holistic approach, so I collaborate with their, meaning clients, physical therapists, counselors, and any other medical professionals that they may have. We work on communication, and I also do speech therapy exercises with physical therapy elements. And she also mentioned that she likes to educate herself on stroke prevention since it's something that many of her clients deal with after their brain injuries. So that is something that she went on to explain a little bit further, was that many of her clients were those that had suffered brain injuries from different kinds of accidents, and so they were working on kind of developing that communication again. And that leads us to what aspect of her career that she finds the most fulfilling. She went on to say, quote, since I work with brain injured individuals and those who have had strokes and they lose their ability to speak, hearing them say their first word as an adult is very heartwarming. This was definitely one of the most standout responses that I got from her, and it's something that we kept talking about just because I found that so fascinating. I also went on to ask what she would advise anybody that's pursuing this field. And she said, don't be close minded about placements and settings you are in. Shadow whoever you can to gain that experience. There are more opportunities for specializations in speech pathology than what you may think. And that was definitely something that I also learned from talking with her and doing my research for the first piece of this presentation. Now I want to go into comparison and takeaways now that we've covered a bit of the interview. So first, comparing this to the textbook, both my personal research and the interview hit on many points that were mentioned in our textbook. Some of the ones that I can think of is the prevalence and risk of declining health as we age, especially when we talked about those brain injuries. I also found a similarity in the mention of the difficulty of healthcare field careers. And this was exemplified to me by Jacqueline's mention of how hard it was to work in the field, and also Cadango's 2022 mention of high turnover rates of nursing home aides. It just felt like something that was kind of very much present throughout all of these different aspects of my research. The last thing I would want to mention is the trickiness that's associated with insurance companies and financing care. Again, that was a whole chapter in our textbook where we covered just how expensive some nursing homes are and other sources of personal care. And it's something that Jacqueline mentioned too. Now I want to go over the takeaways that I've gotten from this. So perhaps the most interesting one is Jacqueline's expression regarding her job. So she said, quote, I gained a new life perspective when I realized that we are the ray of sunshine for the patient who has been in the hospital for weeks. I think I will carry this in my future, even though I'm not planning on being an SLP and I actually want to be a counselor. I would definitely keep in mind the fact that I will be given a role where I have not only a lot of responsibility, but a lot of opportunity to help people out. And so I think that's something that really stuck out to me whenever she mentioned it, and I doubt I will forget it. And it was also just fun to see how many specialties there were for an SLP to choose from. Jacqueline went on to mention a bunch of them and even more areas of work that they can pursue. And it was just interesting to learn something new. In conclusion, learning about a career from a professional definitely helps us see both the good and the bad. I am left with the curiosity of what specializing in older adults might look like in my own future career. I want to aim more of working with teenagers, but I think the older population is still something that's very worthwhile and maybe something I would be interested in the future. Lastly, I wanted to give a little bit of background on why I chose this career. I actually went this route because a friend of mine is doing her master's program in SLP here at NMSU. And I actually asked her if she knew anybody, and she's the one that got me in contact with Jacqueline. So it was very just fun and educative to learn more about her career path and knowing all the things she has to do in these upcoming years. Fun fact, both my friend and Jacqueline have heard about this career from a family friend. They both shared stories with me of knowing about this existence just because a friend of the family mentioned it to them. So I thought that was very fun. Lastly, here are my references, and thank you.